Okay, so hi, it's Dr. Adithya Udupa, and we are back again with the cardinal manifestations and presentation of disease, that is part 2. And in that, we will cover only section A, that is pain, um, and that is the 13th chapter in 21st edition. And this pain, as such, in the beginning, it is same, no issues till the treatment. And as I can suggest I will suggest you to read all the treatment part of uh, cardinal manifestations and prevention of disease, and for that matter all specialties. See here in treatment, there is one addition that when compared to previous one is that there is an oxycodone extended release narcotic analgesic has been added, and when compared to anticonvulsants and antiarrhythmics, there used to be 6 tablets. Now it's only 4 tablets. They have removed phenytoin is removed, and gabapentin, pregabalin, and oxcarbazepine are there. Carbamazepine is there, but phenytoin and clonazepam are removed. And in comment section, there is different. There were no comments in the earlier edition. There are rare aplastic anemia, GA, hepatotoxicity similar to carbamazepine. So some side effect profile is also given. So phenytoin and clonazepam are removed from the treatment part. Otherwise, everything else is same. Even descriptions are same. There is no change. And this one is there. The anticonvulsants and antiarrhythmics. No, this is also same. Sorry. So opioid and till the chest pain. In the chest pain also the beginning are same, and as we move forward you can clearly see that because cardiology is the one very much changing subject, you can easily see after the in the approach you will see that after provoking and elevation factors and abdominal and vital signs, here electrocardiogram is given. The electrocardiogram is being in the same manner, but after that the chest cardiogram is there. Cardiac biomarkers, here is where the difference starts. Usually in the 20th edition, the cardiac biomarkers, there was a clear cut suggestion that it has to be done at the presentation and after 3 to 6 hours, but here that suggestion was removed, and in the next paragraph they have enrolled that rapid rule-out protocols that uses serial testing over a short period of time like 1 to 2 hours, and then troponin should be measured presentation and repeated 1 to 3 hours. This was not there in the previous edition. It was 3 to 6 hours. So this has been changed, and it is because of the new recent guidelines and troponin elevations in the ACS. So this is what is the change: the presentation and 1 to 3 hours. Earlier it was 3 to 6 hours, and then if it is high sensitivity troponin, if it is conventional, then 3 to 6 hours. So earlier it was conventional, now it is high sensitivity is 1 to 3 hours. So just go through this paragraph, 106 page number, you will come to know. And after that everything has changed. Like earlier this was wrong. Earlier what they were given was wrong. It was like you have to go through, for acute chest pain you can't go through a stress test. In the earlier this one they have given echo and stress test as earlier investigations. Here they have changed. Here they have given a coronary and myocardial stress imaging as first, in that as CT coronary angiogram as first, and they have removed some of the parts of the CT angiogram where they have given that because of its other parameters it's not used much often, but that parameter is removed now because CT angiography is emerged as a preferred modality. That's what is given here. And stress nuclear imaging or stress echocardiogram comes afterwards, and exercise electrocardiogram is taken at a very late stage, and they have written also that it is not that much useful in ACS evaluation. Other non-invasive studies, they have included echo and MRI in the last part. Another important thing is that in the hard score they have taken without cardiac troponin. Earlier it was used to be with cardiac troponin. And also EDAC score. EDAC score was not there earlier. There was some other score like North American chest pain rule, but here is an EDAC score. You can go through it, and you can go through the subheading also. These are all the few changes which is made in chest pain, and also they have given the critical pathway for acute chest discomfort evaluation. You have to go through this outpatient evaluation of chest discomfort. These two things you have to go through. As such, there is always something new coming in cardiology or in the angina evaluation, and you should be knowing it firmly that angina evaluation or MI evaluation, there is always triage is the priority and emergency treatment is the priority. That's where everything is heading. And when compared to abdominal pain, when it came to abdominal pain, it's absolute standstill. There is nothing new, there is nothing new, there is nothing new. So it's a good thing that abdominal pain chapter you can safely go through or just skip if you have read the in the 20th edition correctly. And then coming to the headache chapter, there are some like as you know, there is nothing new in the till the approach is same. And when coming to the treatment part, the management part, there is some difference primarily in the management of back pain. The primary and secondary, no, the primary and secondary headache, these are all same. Headache part is also same. The difference comes at back and neck pain. Here in back and neck pain, during the treatment part, I would suggest to go through the treatment part continuously, because there are one thing is that they have given everything clearly, because earlier there was no subheading like NSAID, acetaminophen was not there. They have given treatment back pain and everything was in a flow. There was no subheading of NSAID and acetaminophen or muscle relaxants or opioids. And here they have given clearly that opioids have to be strictly limited to 3 to 7 days even if used. They are of new use. That's what they have given in the earlier edition. In this edition they have added that it has to be strictly limited to 3 to 7 days. And other than that, everything is same. It's not useful in, even steroids are not useful. That's what they have given. Chronic back pain and without radiculopathy, earlier it was given that lasts more than 3 months. Now it's given more than 12 weeks. And both are similar, I know. So non-opioid medications, they have given duloxetine. Duloxetine is approved for treatment of chronic low back pain with coincidental depression. This was not there in the earlier one. So there are minor changes in the treatment. You have to go through them, injections and interventions, and also in guidelines suggest that the referral for an opinion of spinal fusion can be considered. This paragraph was not there in the earlier edition. You have to go through that. Low back pain and radiculopathy, same. Urgent surgery is also important. These are all same. After that, everything appears to be similar to what it was earlier. Other causes back pain. So till here the same. So we will come with the next section, that is alteration in body temperature, and section 2 will complete in next one. Thank you.